Well, the first one is, could you please comment on diet, lifestyle recommendations during sarcoma, such as anti-inflammatory, plant-based, low glycemic diets? Are these helpful? I think one of the challenges that we have with this type of a question is oftentimes when we give recommendations about treatments or therapy, it's because we've studied it in the way that Denise outlined in sort of that very formal process of clinical trials. And unfortunately, we don't have that for many of these. As Nancy mentioned, eating and nutrition is important for your overall well-being. Is it important to eat plant-based over, say, having some animal products? I can't say that one is better. I think the important thing is to make sure that you're getting the nutrients that you need. There's been a lot of controversy about the low glycemic diets, and certainly what I tell my patients is you want to eat healthily for not only your sarcoma, but for the rest of your body. And I would say in general, eating lots of sugars is not in your best interest. But is it better specifically to try and decrease the sugar content? I don't know that there's data to specifically say yes or no. I don't know if Nancy or Denise have any additional thoughts on that.
I'd just like to add that, you know, the part of you that has the sarcoma is one part of you, but you do need to remember that you are a whole person. And that nutrition is very important, but you have to look at any other comorbidities that you may have, such as cardiac issues, diabetes, circulatory problems, and eating healthy for each of those diagnoses that you may have, whether it be a low salt diet, a low glycemic diet, are very important to take care of yourself in totality. Also, to look at any weight loss that you've had or weight gain. Working with a nutritionalist at your center is very important, who can give you helpful hints on how to have a balanced diet.
Denise, do you have any comments or thoughts?
No, I think you both covered it very well. Good, you know, I think everything in moderation and good, healthy diet is important. And unfortunately, we don't have any particular data from clinical research that's been done to say that one particular diet over another is going to be most beneficial. So I think we can mostly refer to, you know, the general basic good nutritional principles.
I think one thing in terms of sort of lifestyle, you know, oftentimes during therapy one is fatigued, but it is important to continue to be active. There certainly are studies in other diseases where people who are more physically active and more physically fit, even in the setting of advanced disease or metastatic disease, actually live longer and better if they are physically fit and active. And so we do encourage patients to be active. Certainly for people who have disease that's involving their extremities, surgery and therapy with radiation can impact your ability to be active. And so it's, I think, very important to work with your team to make sure that if you're having issues that you do see physical therapy to ensure that you can function as well as you can in spite of whatever treatments you've had to remove your sarcoma. Sometimes if people are fatigued, you know, and they've been less active, going and seeing a physical therapist for just, you know, deconditioning or strength exercises can be very helpful. So we encourage everybody to do what you're supposed to do anyway in terms of taking care of yourself, because it's your whole body that you need to be keeping healthy.